Hello everybody, today's program is about one of the important family of bacteria or Neisseria. Maybe please take a pen, two pen, of course dark, black and dark blue. Neisseria C. As you know, CM means family. CM means family. In Neisseria C family, we have some important genus in human disease. First is Neisseria. Second, Ranhamella. Third, Moraxella. Fourth, Acinetobacter. Five, Hassic organisms. Six, Simonsiella. Seven, Aliciella. Seven important species in human disease are Neisseria, Ranhamella, Moraxella, Klebsiella, and also Acinetobacter, Simonsiella, and Aliciella. Welcome. Our focus today is based on Neisseria, Neisseria genus. In Neisseria genus, we have some important species. Neisseria meningitidis, Neisseria gonorrhea, Neisseria sicca, Neisseria cinere, Neisseria mucosa, Neisseria lactamica, Neisseria subflava, Neisseria flaviceps. Important species in Neisseria and human disease. Neisseria meningitidis, Neisseria gonorrhea, Neisseria sicca, Neisseria cinere, Neisseria lactamica, mucosa, and subflavescens and subflava. The most important section is about meningitidis and gonorrhea. Neisseria gonorrhea is the cause of gonorrhea in human disease. The cause of gonorrhea disease. Causes gonorrhea disease. One of the most important sexually transmitted or STD, sexually transmitted disease, gonorrhea disease. And Neisseria meningitidis is one of the cause of meningitis, the most important cause of meningitis in military, and also is so important in 6 months old to 15 years old children. One of the important causes of meningitis. Neisseria gonorrhea or gonococci. Gonococci or gonococci. Other name is gonococci. And meningocoque is the name of meningitis. Gonocoque and meningocoque. Their DNA, about 70% is similar to others. Gonocoque and meningocoque DNA about 70%. Neisseria, yes.
Why called gonocoque?
Gonocoque.
Because the shape?
Yes, about the DNA.
DNA shape?
DNA shape is 70% similar. Welcome. Neisseria gonorrhea and Neisseria meningitis are gram-negative diplococci. Gram-negative diplococci that prefer intracellular living. Of course, in polymorphonuclear or neutrophil. Welcome. Their shape is kidney shaped. Kidney shaped or bean shaped. Kidney shaped or bean shaped. In gonocoque, pili is so important. In gonocoque, the role of pili or fimbriae is so important in gonocoque. And in meningocoque, capsule, polysaccharide capsule is so important. Gonocoque causes disease only in humans. Gonocoque and also meningocoque causes disease only in humans. Other species sometimes are in upper respiratory tract. Upper respiratory tract in humans. Neisseria gonorrhea or gonocoque is obligative intracellular living. Obligative intracellular living. Obligative intracellular living, but 5 to 10% CO2 is precipitate the growth of bacteria on culture media. Is good situation for bacteria. 5 to 10% CO2. Gonocoque needs to iron, starch, cholesterol, and albumin. It means gonocoque is fastidious. Gonocoque is fastidious. Fastidious organisms needs to iron, cholesterol, starch, and albumin. The primitive culture for isolation bacteria is chocolate agar. Chocolate agar. Chocolate agar is a kind of blood agar that heated about 70 centigrade for inhibition of some factors, for example, fatty acid and some inhibitor of bacteria. Chocolate agar is a kind of blood agar that heated about 70 centigrade. But the best culture media is modified Tyre-Martin. Modified Tyre-Martin, VCNC. There are 4 antibiotics can inhibit another microorganisms and lead to bacteria for better growth. VCNC, vancomycin, colistin, nystatin, and cotrimoxazole. Vancomycin inhibit growth of gram-positive cocci, just as Staphylococcus. Colistin inhibit gram-negative bacilli. Nystatin control and inhibit fungi. And cotrimoxazole inhibit gram-positive and gram-negative. And totally, these antibiotics led the better growth of Neisseria on culture media.
What the function of modified?
Modified is better or good situation, or added some things. Added some things means some antibiotic added to culture media. For culture media is Tyre-Martin. When you add for antibiotic, it would be modified. Modified led to bacteria for better growth. It is specific for Neisseria gonorrhea or gonocoque. Tyre-Martin or modified Tyre-Martin VCNC.
And we use chocolate agave for
Also for
for
primitive.
bacteria.
Yes. Chocolate is public, more public.
Yes.
And for differentiation from normal flora, we need to Tyre-Martin. It is our gold standard and specific media. In this medium, welcome. In this media, we have rough colony or R colony. R colony. As you know, we have sometime colony. S, R, N, loop forming, folding, sleeping, and L4. Well, the form is, its colony is R colony or dehydrated colony. Neisseria gonorrhea in culture media has 4 type colony. T1 and T2. T1 and T2 have pili, but T3 and T4 has no pili. Neisseria gonorrhea or gonocoque has 4 important antigens. 4 important antigens. First, pili. Pili or Fimbaria. Pili or Fimbaria. Each gonocoque has 8 type pili. Can convert about 10 to the power of 3 to 10 to the power of 4 times to other forms. And we have a collection of pili, a variation of pili. Pili is so important for pathogenesis. Without pili, we have no disease. And only pili causes gonorrhea disease. Only pili alone. The second factor or second antigen is outer membrane protein. Outer membrane protein. In gonocoque, we have 3 types outer membrane protein. Type 1 or pore. Type 2 or opaque. type 3 or O and RMP. Pore or porine, opa or opacity, RMP or reduction modifiable protein. Reduction modifiable protein. The most important protein in outer membrane protein is pore. About 60% of outer membrane, about the weight, is pore. The third antigen is lipo-oligosaccharide, or LOS. LOS. In contrast, other gram-negative bacteria, here we have no lipopolysaccharide. We have lipo-oligosaccharide. Lipo-oligosaccharide. And finally, we have fragile polyphosphate. Polyphosphate capsule in young microorganisms. You tell me, important antigen of bacteria. First, ED, or in pathogenesis, belongs to antigens, some pathogenic factors, important pathogenic factor. The most important pathogenic factor is pili. I told you, only pili causes gonorrhea disease. It attaches to epithelial cell of urethra. Epithelial cell of urethra. And also, pili has the role of agglutination of RBC. Agglutination of RBC. And also, pili has antiphagocytic effect. Antiphagocytic effect. Pili has three roles: attachment, antiphagocytic, agglutination of human RBC. The second important factor in pathogenesis is number 2 protein, or OPA, or opacity factor. Opacity factor is the second factor. Opacity. Opacity is complement for pili. Complement for pili. The third factor in pathogenesis is lipo-oligosaccharide, because it has lipid, and lipid has endotoxin effect. All of gram-negative have endotoxin effect. Endotoxin destruct the epithelial cells. Endotoxin destruct the epithelial cells. And finally, IgA protease enzyme. IgA protease enzyme destructs IgA1 protease immunoglobulin on the surface mucosa and also its secretory media, and causes decreased immunity against bacteria. And also the capsule, fragile capsule polyphosphate, has anti-opsonization effect. Anti-opsonization. Opsonization is facilitated phagocytosis. Facilitated phagocytosis. And it has anti-opsonization effect. Anti-opsonization effect. Well, we have opsonization. Anti-opsonization. When you have opsonization, you have facilitation for digestion of bacteria. But capsule causes protect the bacteria.
Water therapy.
Yes, this is antidote of it. Yes. We have 5 pathogenic factors. The first, PD. Second, OMP, of course, opacity factor. Third, LOS, IgA proteases. And finally, capsule, polyphosphate capsule with anti-opsonization effect. The way of entrance or route of entrance in gonorrhea is mucosal surface. Mucosal surface in urethra or endocervix. Of course, another mucosal surface just as eye, just as pharynx, and just another surface mucosal maybe would be the way of entrance. After entrance and attachment by PD and complement. The bacteria multiplied. The bacteria multiplied. And we have infiltration of polymorphonuclear or neutrophil cells against bacteria. Polymorphonucleose or infiltration of white blood cells. And we would have obstruction of urethra, and sometimes cystic formation. Gonorrhea is one of the most important STD in all of the world. It depends on age, race, genus, and some conditions, for example, cultural, economic, and social factors. The average age for gonorrhea is 15 to 29 years old, the average age. And the incubation period for gonorrhea is 2 to 7 days. The symptoms and signs in gonorrhea in men and women may be different. About 90% of men with gonorrhea have symptoms, 10% asymptomatic. The most important symptoms are dysuria, frequency, purulent secretion, and sometimes prostatitis, epididymitis, and also some cyst formation. In men, we have symptoms. 90% men are symptomatic for dysuria, frequency, and purulent secretion, and sometimes prostatitis, epididymitis, and obstruction or cyst formation. But in women, about 20 or to 80% are asymptomatic in women. 20 to 80% are asymptomatic. And some important symptoms are bleeding, disintegrity in menstruation, purulent secretion, dysuria, and also we have PID or pelvic inflammatory disease. Pelvic inflammatory disease is so important because it led to infertility, and also ectopic pregnancy. ectopic pregnancy, or EP. Pelvic inflammatory disease is so important because it led to ectopic pregnancy and also infertility or sterility. The most important cause of sterility or infertility in USA is gonorrhea, Neisseria gonorrhea. And also, in women, sometimes we have perihepatitis or Fitz-Hugh-Curtis syndrome. Fitz-Hugh-Curtis syndrome or perihepatitis due to Neisseria gonorrhea. Perihepatitis. Another complication, another important complication due to Neisseria gonorrhea are vulvovaginitis. Vulvovaginitis. Also, in newborn, we have ophthalmia neonatorum. Ophthalmia neonatorum. Ophthalmia neonatorum in newborn, in delivery, in the time of delivery. Ophthalmia neonatorum is so important. Sometimes we have pharyngitis. Sometimes pharyngitis due to gonorrhea, and also sometimes arthritis dermatitis. Arthritis dermatitis syndrome or disseminated form of Neisseria gonorrhea, with fever, lassitude, and some pain in bones, and also some skin disintegrity. Well, any question about symptom and signs?
All this disease come from Neisseria?
All of them belongs to Neisseria gonorrhea. Gonorrhea. Our focus is based on Neisseria gonorrhea. Yes. And there are symptoms of Neisseria gonorrhea. Of course, I told you, in men and women, we have some differences.
Yes.
In women, we have seronegative sometimes, and involvement with another bacteria. Maybe mimic the diagnosis, but in men, it's symptomatic, about 90%. For diagnosis of Neisseria gonorrhea, good sample is so important. The best sample is discharge of urethra, and also sampling from endocervix. Neisseria gonorrhea in men. Neisseria gonorrhea in men is the only bacteria that you can diagnose by direct smear or gram staining. Because I have told you before, for all of bacteria, we need to confirmation test by culture. We have two exceptions, Treponema pallidum and Mycobacterium tuberculosis. But Neisseria gonorrhea can be diagnosed by only direct smear or gram staining. It's so important. But in women you need to culture, because you have seronegative bacteria and need to confirmation test by culture. What is the only bacteria that you can diagnose by direct smear. Neisseria gonorrhea in men only, in men. Don't forget. The best drug or drug of choice for control of Neisseria gonorrhea is ceftriaxone in combination with azithromycin. The best drug for control of Neisseria gonorrhea is ceftriaxone, third generation cephalosporins, and azithromycin or macrolide. Other drugs, just as penicillin, spectinomycin, ciprofloxacin, and also tetracycline, had good effect, but some resistance to this drug has down. What is the best drug? Ceftriaxone and azithromycin. Combination of ceftriaxone and azithromycin is the drug of choice for treatment of Neisseria gonorrhea.
That's for men or man, woman?
Oh, no differences between men and women. No differences. With this combination, we have at least resistance to antibiotic. But another type, just as ciprofloxacin, penicillin, and also tetracycline, spectinomycin are good drugs, but resistant, maybe in women and men, both of them. Neisseria gonorrhea has no vaccine because PILI has so important role. We have about 1,000 antigen by PILI, 1,000 to 10,000 type of PILI, and the vaccine synthesis is so difficult. Yes? But training and education of hygiene situation, and sometimes prevention by some antibiotics, just as minocycline and doxycycline, and sometimes in ophthalmic disorder, using of some eye drops, just as erythromycin and also tetracycline, maybe control the infections in ophthalmic neonatal disease. Any question about Neisseria gonorrhea? Neisseria gonorrhea, yes. I told you about Neisseria family with important genus Neisseria. I told you all of them or many of them are commensals, and two important human pathogens are gonocoque and meningocoque. I told you they prefer intracellular living in neutrophil or polymorphonuclear. They have kidney shape or bean shape in intracellular. And also all of Neisseria, gonocoque and meningocoque are oxidase positive. Oxidase positive. You can change of color, alteration of color, and oxidase negative. This is no change of color, oxidase negative, and change of color. Purple color means oxidase positive, because gonocoque is glucose positive, oxidizing, and meningocoque is glucose and maltose positive. It is differentiation between them. Glucose positive only for gonocoque, and meningocoque glucose and maltose, oxidizing. I told you for primitive culture we need to chocolate agar, and also selective or differentiated medium agar is modified Thayer-Martin agar. You can see the structure of bacterial capsule, pili, outer membrane protein, and other structure. I told you about the role of capsule. It has anti-opsonization or inhibit opsonization. Pili has adhesion effect, antiphagocytic effect, and also agglutination of red blood cells. And IgA protease degrades or destructs IgA1, and also LOS or the kind of LPS and the toxin effect. And up to in gonorrhea, I told you humans are the only natural hosts. Portal of trial is genitourinary tract and other mucosal surfaces in unprotected sex, contact with eyes and mouth, and mother-child during birth. The most important is gonorrhea sexually transmitted is one of them. In men, acute urethritis or symptomatic, and in women, cervicitis and asymptomatic, about 20 to 80. And other complication is neonatal conjunctivitis from mother to child, vulvovaginitis, and oral infection or pharyngitis. This is comparison by some STD organism, trichomoniasis, chlamydia, gonorrhea, genital herpes, syphilis, and AIDS, or HIV. You can see conjunctivitis or infection of eye by Neisseria gonorrhea from mother to child. And also you can see ophthalmia infection in adults. And you have red eye and congestion of eye. Sometimes about 1 to 2% we have disseminated form or skin lesion due to Neisseria gonorrhea or arthritis dermatitis syndrome. Arthritis dermatitis syndrome. Well, any question about gonorrhea?
Yes, I understand. Yes.
No. This is disseminated, I told you. In some person with deficiency in complement system, complement proteins, we have 9 complement systems. When we have defect in complement system, we have disseminated form or spreading of bacteria in bloodstream. In bloodstream, we have arthritis, polyarthritis, and dermatitis. Or this form, you can see gonococcal infection or skin lesion due to gonococ. Well,
Why there is no vaccine for? Why there is no vaccine?
I told you because it
Because
has
there's
pili,
common
so many type of pili, and identifying the pili is so difficult. You need to 1,000 vaccine for control. It is so difficult, and it has no benefit.
So for all bacteria, if you want to make vaccine, you should know the pili.
In all of bacteria, with pili synthesis, vaccine is so difficult because you must identify all of type of pili, and it is so difficult. But in gonorrhea is very, very important because pili can convert about 10 to the power and 10 to the 4 times to other type of pili, and it is so difficult and is not good situation for vaccine synthesis. The other bacteria from Neisseria genus is meningococcus. Meningococcus or meningococci. Meningococcus, just as Neisseria gonorrhoeae, is gram-negative intracellular diplococci. The route of entrance or the way of entrance is respiratory tract from aerosol or droplet when you speak, when you sneeze, when you coughing. Neisseria meningitis may be spread. About 5 to 15% of humans have Neisseria meningitis in the throat, normally, in upper respiratory tract. when the bacteria enters to the body, multiply in upper respiratory tract, and then goes to bloodstream and causes clotting or thrombosis. Causes thrombosis. Thrombosis or blood clotting. Blood clotting. And also sometimes we have DIC or disseminated intravascular coagulation. Disseminated intravascular coagulations. And finally, we will have necrosis, endothelial necrosis in vessels, endothelial vessels. We have thrombosis, DIC, and necrosis due to meningocoque. Meningocoque is so important in human disease for meningitis in military persons and also between 6 months to 15 years old. In 6 months to 15 years old. And also in crowded situation, for example, in Hajj, in military, in refinery, oil refineries, in some personnel, laboratory personnel, infants, in immunocompromised person, you have the high rate of meningococcemi disease. It has two complications. First is meningococcemia. Meningococcemia or entrance of bacteria to bloodstream. Meningococcemia. The severe form of meningococcemia is Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome. It was a type of question for your exam. Waterhouse-Friderichsen. What is the cause of it? Neisseria meningitis. Waterhouse-Friderichsen syndrome. It is severe form of meningococcemia due to meningococcus. And finally, we have meningitis. I told you one of the important causes of meningitis in military persons and between 6 months to 15 years old. The second cause of meningitis after Haemophilus influenza is Neisseria meningitis in children. The symptoms and signs of meningitis due to meningococcus is classic, just as fever, chills, nausea, vomiting, neck stiffness, and decrease of consciousness or unconscious situation or no alertness. Neisseria meningitis, just as gonococcus, is oxidase positive, but also glucose, you have oxidizing of maltose. Meningococcus is glucose positive, maltose positive, but gonococcus only glucose positive. Neisseria meningitis have 4 types of antigens. 4 types of antigens. First, polysaccharide capsules. Polysaccharide capsule. Based on polysaccharide capsule, we have some important serogroups. A, B, C, X, Y, W135. Important serogroup, of course, about 13 to 14 serogroup we have. But important are A, B, C, X, Y, W135. A serogroup is important in poor country. B and C are so important for meningitis. And Y and W135 important for pneumonia, bronchopneumonia, respiratory disease. Yes? A in poor country, B and C for meningitis, Y and W135 important for pneumonia and respiratory infection disease. The polysaccharide serogrouping is based on N-acetyl-glucosamine and N-acetyl-monosamine phosphate. N-acetyl-glucosamine and N-acetyl-monosamine phosphate. Differentiate the serogrouping. Some important that I've told you. The second important antigen is outer membrane protein, just as gonocoque. But here we have 5 types. In gonocoque we had 3 types, POR, OPA, RMP. Here we have 5 types of outer membrane proteins. The third important antigen is somatic antigens. Somatic. It is combination of nucleoprotein and carbohydrate antigens. Nucleoprotein and carbohydrate antigens. And also, PLE is so important, of course, only in respiratory tract infections. PLE is more important in gonocoque, but in meningocoque, capsule is more important.
We don't have leave all these saccharides.
Also, is not important in antigen structure, but it has important role in pathogenicity. I will tell you. The most important factor in pathogenicity are first, capsule, polysaccharide capsule, because it protects bacteria and also it has antiphagocytic effect. Yes, the most important is capsule. The second pathogenic factor is endotoxin, because the bacteria has lipo-oligosaccharide, but is not important just as gonocoque. And this liposaccharide has endotoxin effect and obstruct and necrose endothelium of vessels, and causes some situation just as DIC. The third pathogenic factor is IgA protease, just as gonocoque. IgA protease enzyme that I told you inhibit and destruct IgA1 section. And finally, in respiratory form, PLE is important. But you must know the PLE is so important for gonocoque, but polysaccharide capsule in meningocoque are important. For diagnosis, good sample is from blood, from CSF or cerebrospinal fluid, and some scraping from lesions, skin lesions. The bacteria there is in lesions, skin lesions. After sampling, you need to direct smear at gram staining. In gram staining, you have gram-negative intracellular diplococci, just as Neisseria gonorrhea. Gram-negative intracellular diplococci. And then you need to culture, to blood culture, or some culture media, just as chocolate agar and Thyre-Martin agar. And in some person, maybe consumption of antibiotics. In this situation, you need to serology test. Serology test in some patients have consumed antibiotics. just as counter-immunoelectrophoresis test, ELISA, latex agglutination. And sometimes IF, immunofluorescence. In this person, you seek or look for bacterial antigen, not bacteria, bacterial antigen in cerebrospinal fluid. When you need to serology test, when the person consumes antibiotics and you need to serology test, just as counter-immunoelectrophoresis, ELISA, latex agglutination, and immunofluorescence. The best drug for control and treatment of meningitis due to meningococcus is penicillin G. Penicillin G. And also you can use from ceftriaxone and cefixime and cefuroxime. Ceftriaxone, cefixime, and cefuroxime. And also needed to maintaining electrolyte and water balance, treatment of DIC, and control of respiratory situation. Meningococcus has vaccine. Vaccine is polyvalent vaccines. Polyvalent. With serogroup A, C, Y, and W135 serogroup. 4 serogroup. A, C, Y, W135. In military persons, in some person have a splenectomy, and when you have traveled to endemic area. And sometimes maybe control and prevention by some antibiotic, just as rifampin. Rifampin in near family is maybe needed.
Does mean use polysaccharide for reduced vaccine?
What?
Does mean use polysaccharide antigen for reduced vaccine?
Yes.
Yes.
It's exactly.
Not really.
No, yes. And in contrast of pneumococcal, I told you, it has polyvalent vaccine. Which serogroup? A, C, Y, W135. I told you about antigenic structure of meningococcus. Important serogroup are A, B, C, X, Y, and W135, and also Y serogroup. And also outer membrane protein, we have 5 types of outer membrane. It is comparison between meningitis and pneumococcal. The way of entrance or transmission of meningococcus is respiratory tract or aerosol or droplets or aerosolizations. And just as pneumococcal, human are the only natural hosts. Two important diseases due to meningococcus is meningitis. I told you between 6 months to 15 years old children, and also meningococcemia, and severe form is Waterhouse-Friderichsen syndrome. Waterhouse-Friderichsen syndrome is bilateral bleeding of adrenal and DIC. Bilateral bleeding of adrenal gland and also DIC. And of course, some situations just as fever, chills, and lassitude. Meningococcemia or severe form of Waterhouse-Friderichsen, some symptoms just as high fever, chills and myalgia or muscular pain, weakness, nausea, vomiting and headache, skin lesion, and sometimes pulmonary insufficiency. You can see a skin lesion to meningococcus. Skin lesion, because I told you sometimes you can take a sample from skin lesion. Important differential diagnosis between meningococcus is with Streptococcus pneumoniae, Haemophilus influenza, and also Escherichia coli. What's important differential diagnosis? You can read.
First one?
First, a Streptococcus pneumoniae or pneumococcus. Second, Escherichia coli or E. coli from Enterobacteriaceae. Third, Haemophilus influenza. I will teach you the next session. Haemophilus influenza. They are important differential diagnosis and maybe distinguish with them. About the age susceptibility, I told you under 15 years old, between 6 months to 15 years old. Some persons are at risk to meningococc. Infants, children, travelers to endemic area, caregivers, immunocompromised person, for example in chemotherapy and some malignancy, crowding just as students, military, head and oil refineries, and also personnel working with this bacteria in laboratory. About laboratory diagnosis, I told you in gonorrhea and meningococcus, we have intracellular diplococci gram-negative, intracellular. They are intracellular in neutrophil and polymorphonuclear and also gram-negative. You can see two bacteria are diplococci. One of them is gram-negative, Neisseria, gonorrhea, and meningococcus, and gram-positive is pneumococcus. Gram-positive pneumococcus, gram-negative, gonorrhea, and meningococcus. You can see two culture media, primitive culture media, chocolate agar, and tile marty or advanced media. I told you differentiation or distinguishing between gonococcus and meningococcus is based on oxidizing of sugars. Gonococcus is glucose positive, maltose negative, but meningococcus is positive both, glucose and maltose, and also both of them are oxidase positive. Gonococcus, some resistant to penicillin, tetracycline, streptomycin, fluoroquinolone, just as ciprofloxacin or fluoxacin, and the best drug that recommended by CDC or Center of Disease Control is ceftriaxone, of course, combination with azithromycin. Ceftriaxone and sometimes cefixime by azithromycin combination. The best drug is ceftriaxone, azithromycin. And for treatment of meningococcus, you need to penicillin G and sometimes third generation cephalosporin, just as ceftriaxone, cefotaxime, sometimes cefuroxime are important. And also we have vaccination and drug prophylaxis by rifampin in near family. About meningococcus, any question about meningococcus? Another Neisseria. Another important Neisseria are causes opportunistic infections. Opportunistic infection in human disease. One of them is Branhamella. Important species is Branhamella naturalis. Branhamella Granhamella catarrhalis, similar to gonocoque and meningocoque. Gram-negative diplococci. It has much more resistant in physical and chemical situations. And you can culture the bacteria nutrient agar, nutrient broth, and blood agar. It's not fastidious. Granhamella catarrhalis, it's not fastidious. It causes opportunistic infection, just as laryngitis, tracheitis, bronchitis, sinusitis, and otitis media. Important disease to Granhamella catarrhalis are laryngitis, tracheitis, bronchitis, sinusitis, otitis media. Another important is Moraxella, Moraxella laconata. Moraxella laconata, diplococci, gram-negative, oxidase positive, just as Granhamella, oxidase positive and sensitive to penicillins. Moraxella causes ophthalmic disorders and infections and gastrointestinal tract infections, and also causes some septicemia, peritonitis, and endocarditis and meningitis. But important diseases to Moraxella are ophthalmic disorder and gastrointestinal tract infections. Moraxella laconata. Another important species in Neisseria family are Acinetobacter. Acinetobacter baumannii. It is so important in ICU patients because it is so resistant to antibiotics. Acinetobacter baumannii. It is oxidase negative. The only oxidase negative is Acinetobacter and so resistant to penicillin. Acinetobacter baumannii. It causes some skin disease, and also it is opportunistic infections, just as peritonitis, septicemia, and endocarditis. The cause of resistance to antibiotic in Acinetobacter baumannii is efflux pump. Efflux pump. Efflux pump. Efflux pump excretes the antibiotic to out of bacterial cell, and you have no accumulation of antibiotic in the bacterial cell wall, and you have no enough concentration of antibiotic in bacterial cell. And finally, the last section is Hasek organism. Hasek. There are 5 microorganisms. Hasek. Hasek. All of them are fastidious gram-negative bacilli. Fastidious gram-negative bacilli. Fastidious gram-negative bacilli. That causes SBE, or subacute bacterial endocarditis. Subacute bacterial endocarditis. Some gram-negative, fastidious bacterial causes, all of them, subacute bacterial endocarditis. because the bacteria goes onto bloodstream. These 5 microorganisms are Haemophilus, Afrophilus, Haemophilus, Afrophilus, A. Actinobacillus, Actinomycetum, C. Abbreviate from Cardiobacterium, hominis, E. Abbreviated Echinella corrodens, Echinella corrodens, and K is Kingella kinga. There are Hasek organisms, Haemophilus, Afrophilus, Actinobacillus, Actinomycetum, Cardiobacterium hominis, Echinella corrodens, and Kingella kinga. All of them fastidious, gram-negative, causes subacute bacterial endocarditis. And also, this group of bacteria causes pitting on culture media. Pitting on culture media because they can produce polygalacturonic acid. Hasek organism produce polygalacturonic acid and causes pitting on blood culture and digestion of blood culture. Well, you tell me Hasek organism. First, H. First, H. Haemophilus, Afrophilus. Second, A. Actinobacillus, Actinomycetum. C. Cardiobacterium hominis. E. Echinella corrodens. And U. K. Kingella kinga. All of them gram-negative bacteria, fastidious, causes subacute bacterial endocarditis, and also on culture media we have pitting situation or digestion of blood agar because they produce polygalacturonic acid. Very good. Any question? Thank you so much.
This disease